1 second. Hey there, Dr. Rob Davidson here with Committee to Protect Medicare, and this is going to be a semi-regular installment here, trying to go on Facebook Live and just share a response to the news of the day, some of the news of the coronavirus task force briefing and/or Donald Trump's press briefing. And I'm going to have different folks join me today. Again, I have Dr. Farhan Bhatti, primary care doctor in Lansing. I'll let him introduce himself and maybe just a little bit of a kind of general feel of what's been going on today, and then we can talk a little bit more in depth and yeah, hopefully get you some honest, truthful information about what is happening and maybe filter a little bit of what we've been hearing from the president these past few days.
Sure. Well, hi, everybody. This is Dr. Bhatti from Carefree Medical in Lansing. Lansing today was the site of a protest of folks who were coming out in opposition to the governor's stay home, stay safe extension. And my office is a mile north of the Capitol, so the traffic from the protest was all the way down, past my clinic, making it difficult for my patients to even get access. What's happening is really, really unfortunate because the president has basically successfully turned this into a partisan issue when it absolutely does not need to be. And that's my biggest source of frustration right now is how did all of a sudden the health and well-being of our population become a political partisan issue? Saving lives and keeping everybody safe should be a bipartisan thing. And unfortunately, by the president minimizing this for several months and now trying to do damage control, a lot of people who are aligned with him politically are still of the mindset that this isn't as serious, or they don't need to take this as seriously as it needs to be taken. And so opening up the economy, which is their big talking point, they want to open up the economy and get people back to work. Well, I want that too. Everybody wants to go back to work and live the life we were living before this started. But if we do that too quickly, we're going to lose all the progress we've made, infect people all over again. We're going to have a second wave, and that curve that we've started to see flatten, it's going to spike all over again. So that's really my biggest concern and my source of frustration right now is that Democrats want to do social distancing, and too many Republicans are just talking about, hey, let's go back to work, and it's too soon for that.
Yeah, and for context, here in Michigan, Governor Whitmer, I think she's issued one of the most restrictive shelter in place, or stay home, stay safe, as she calls it, one of the most restrictive orders. It goes for another 15 days now through April 30th. And what we've seen here in Michigan, particularly in Southeast Michigan, around the Detroit area, 3 main counties there, probably maybe the second biggest hotspot in the country right now, second to the New York area. And certainly we're seeing the number of new cases decrease, but still seeing significant new cases every day there. And, as a response to when that started, I don't remember exactly when her stay home, stay safe order started, but it was, I think about 3.5, 4 weeks ago, somewhere in there. We've seen that kind of hit its peak and start to flatten out a little bit, maybe a plateau, maybe coming down the other side. I know where you are in Lansing, where I am in West Michigan, we haven't seen nearly that many cases. I've admitted people to the ICU in my hospital. We have out here in West Michigan all over. I'm in a small hospital, so our numbers are lower kind of overall. But I've seen a lot of patients with symptoms. A lot of people I can't test because of the lack of the ability to test, because we just don't have either the swabs or the reagent or the tests themselves. My wife's a family doctor. She does statewide screening on the phone, and probably about 1/3 of her patients that call in with symptoms fit the criteria of people who can get screened and can get tested. And so like you said, we have made significant progress. We've seen the cases start coming down in those very hotspot areas, Southeast Michigan in particular. And we haven't seen massive numbers of cases in other sort of semi-metro areas, Grand Rapids, Lansing, Saginaw. They're creeping up, in all these places. So I think to end this order now would be so premature. We're just hitting our slope going up as the number of cases where I'm at, I think where you're at as well. And so if we just start going back to normal or even relaxing this even a little bit, my fear is that we're just going to continue to see the explosion of cases. And frankly, if we were testing everybody with symptoms and people without, we would see tremendously greater number of cases even right now. And I think, like you had said to me privately, so what was it all for if we just kind of go back on it now? What was the point of it all? Some sacrifices that were significant for so many people thus far will have been all for naught. And the big risk is A, more people dying, and B, completely overwhelming our health systems, our local hospitals like mine, like the ones that you serve there in Lansing, and having more people die, both of COVID-19 and of other illnesses that otherwise would be treatable. But if we don't have capacity, we just can't take care of those folks.
Sure. I mean, from my perspective, the only thing worse than shutting the economy down once is shutting the economy down twice. Right. So if we go back to work and reinfect each other or infect each other, and then you start having people have to miss work, productivity goes down, economic output, we're not going to get nearly the boom that we're expecting to get if we go back to work too soon, because people are going to stay home sick. And then the number of cases will start to rise again, and we'll have to shut down again, and we'll have to go through this whole exercise all over again. So, and I know that the economic recovery will be that much harder if we have to shut everything, open up everything, and then shut everything back down all over again.
Right. Now, what do you think is the single biggest thing we need to be able to open? We say we want to open, we want to do it, safely. What do we need to do that?
The most important thing we need is a comprehensive plan that involves testing on a large scale. Because right now in America, we're testing maybe 100,000 people, and we have to be testing people in the millions.
Per day, that's what you're saying.
Per day, right? Yeah. 100,000 people per day is not nearly enough to accurately project where is this moving, how many people actually have it, are we going to see a spike here, is there going to be another city that has an outbreak like Detroit did? Unless we're doing testing on a much larger scale, we just don't know. So when we start to slowly open up the economy, we can't do that unless we are testing accurately for exposure, antibody tests, because the only two ways from a medical point of view to ensure everybody's safety is either develop a vaccine or develop herd immunity. Herd immunity is where enough of the population has antibodies that they're effectively protecting everyone. So not nearly enough of the population has been exposed to develop herd immunity. And so we neither have that nor a vaccine. So this has to be done responsibly, safely, with bipartisan cooperation. And we have to put people's lives over profits. It's just that simple.
And I couldn't agree more. And I think the one thing that makes this virus unique, if we wait for deaths to start happening or for critically ill people to start presenting to hospitals to recognize we now have a new hotspot, we are too late, right? This virus, once you are exposed, can take at least a couple of weeks to show up, 8 to 14 days to actually show up as symptoms. And then it can be another 2 weeks before you start to really get sick. You might have minor symptoms initially and not go anywhere. And then a few more weeks before you actually present to the hospital, and a little more time after that before you end up in the ICU. So if we're using, either hospitalizations or deaths as our marker of needing to shut it down again or shut down certain areas, I feel like we're going to just be chasing our tail for at least another year, probably more, and having so many unnecessary deaths. We may inadvertently achieve herd immunity simply because of this kind of haphazard way that at least it sounds like the president is suggesting we come online. Today he suggested They had calls with many leaders in business, and he said healthcare, but I think truly most of them were health insurance and hospital system people. So these are more, business people who are ready and raring to go. But he said they've identified 29 states they think would be ready to go by May 1st or sooner, he said. I can't fathom that that is true, that you could do that in a safe way, because from our committee, the Committee to Protect Medicare, we have, I think nearly 400 docs across 40 states. I talked to them, talked to docs in Colorado, talked to docs in New York, in Southeast Michigan, down in the South in Florida. Every single one of them tells me I can't test the people I want to test. This is everywhere. And so, yeah, I share your frustration. Now, a question I have for you, and this is something you talked about and you deal with, I think, at Carefree, that the mental health concern of staying shut down. I think that's probably the biggest thing I hear coming from people on the other side. Well, the cure is worse than the disease. People are committing suicide in droves, and this is going to be worse than how many people can die from the virus. I guess maybe speak to either A, the suicide part, and then B, just the overall mental health part of it.
So the first thing that I would say to that is there's no data that suicides are actually up. So we'll just put that out there, number one. Number two, yes, it's true that anxiety and depression are at much higher levels than they were before the pandemic started. But that's for any number of reasons. It's not just because the economy shut down. It's because, I've got patients whose family members have died from coronavirus, whose close friends have died. And so people are also grieving and they're scared. Is this going to happen to me? Am I going to be the next person that gets critically ill and potentially dies from the coronavirus? And so I think it would be equally, if not more, anxiety provoking if we opened up the economy too soon. I mean, the patients that I saw today were basically expressing this concern, like they're anxious, and one of the triggers for their anxiety right now was the protest that was happening today, and the idea that people think that it's actually somehow safe to go back to normal. And my patients were scared, if everything tries to go back to normal, then I'm going to be the next one that gets sick and dies, or how am I going to be able to protect my family? How am I going to be able to protect my grandma who's got COPD if everybody just goes back to work and tries to live normally again? So shutting down the economy is certainly one of the things that people are concerned about. And, people haven't been working for maybe 6 weeks and they're, trying to collect unemployment. And of course, that's a stressor, that's a trigger, but so is the disease itself and the worry about their safety and the safety and health of their families and their friends and community. So I kind of think that it's a laughable thing for the president to say, honestly, and a really unfortunate thing to try to use mental health as an excuse to open up the economy, when in reality, a bigger trigger for mental health is the worry about the disease itself. And
yeah, that's what I'm seeing too. A lot of people coming in with symptoms of anxiety and just afraid to go out, afraid to go to the store. And, I want people to be cautious and concerned. We certainly don't want people to be afraid, but we want them to be informed. Please, yes, wear a mask, wash your hands religiously, only go out in groups of one if you have to go to the store, and only go for essential items that you need. I went to the grocery store today, and the store I went to had a strict enforcement of the number of people in the store, had us waiting in line outside 6 feet apart. And it was noticeable when you're in there, you could walk through without brushing shoulders with anybody, and you waited 6 feet to get to the register. And, I applaud stores that do that. And, I hope people will patronize those places that do observe this physical distancing that we need. And I guess I would love to put out a message to the folks who are in that protest in Lansing that I saw that has been widely reported. The folks who are against what they're calling a quarantine, really the stay home, stay safe order. We're on your side. I don't ask people their political affiliation, who they voted for. I guarantee you, when I go in a room in my hospital, because of where I work, there are more TV channels on Fox than there are on any other news channel, if they're on a news channel. I would dare say 70% of the people that I see, if they voted, probably voted for President Trump. And yet I care about these people. I have conversations, I get to know these people and their children. And I want them to go back and be able to earn a living and support their families the way that they are used to doing. And yet I also don't want them to die, and I don't want their parents to die. And I don't want to be in a position to tell them someday, well, I'm sorry, I don't have a ventilator for your loved one. They're not going to make it, and I don't want to turn and look to my left, look to my right, and see my nurses or nurse assistants getting sick and going offline and not being able to work, and potentially getting very sick. We've seen healthcare workers die at a higher rate or get sick at a higher rate than the general population. I want to protect those people as well. And that's what we're trying to do by the stay home, stay safe message and the order I know from our governor. So, again, we're on your side. If they want to make this partisan, I won't go there. I've been very critical of the president only in the actions and inactions of his response to this effort, in no way directed at him individually. It all has to do with what he's done and how it's impacting the folks that I see, the folks that you see. So, there is a home for y'all here. And when you come to my hospital, you go to your clinic, we're going to treat you. We're going to treat you with compassion and do everything we can, but we want these folks to help us so we can help more people and not become overwhelmed.
Yeah, and I want to echo that. I mean, like I said at the beginning, this should not be a partisan thing. Everybody should be on the side of saving as many lives as we can. And if and when the president makes a move that is going to advance public health further, I'll be the first person to come on here and congratulate him and thank him for doing something in the interests of public health. But unfortunately, right now, we're not seeing that. We are seeing some good work happening from Republicans across the country too, and we can talk about that, like in Ohio and Maryland. There are Republican governors that are taking this.
Governor DeWine and Governor Hogan, doing great work.
Absolutely, they're taking it seriously, and so we need more of that. We need more people from all political stripes to say now is not the time to score political points. Now is the time to just come together in the best interest of our country to save as many lives as we can.
Great. I can't think of a better way to wrap this up. I appreciate that sentiment. I know it comes from your heart, just because of what you do and the people you serve every day. And so, to anyone who's watching, keep an eye on this space. We're going to try to do this semi-regularly with Dr. Bhatti, with other doctors from our committee, and most of the time me, and sometimes not me. But we're just going to do our best to kind of bring to you what we think is the most important information of the day when it relates to dealing with this crisis. So thanks again, Dr. Bhatti, and have a great evening.
You too. Thank you.
Thanks.